My medical journey started at my home country in Syria, where I did my medical school. After graduation, I joined the University of Kentucky as a researcher. This is followed by my internal medicine residency at the University of Central Florida College of Medicine, where my passion for cardiology started. I followed this passion where I joined the Baylor University Medical Center, the Heart Hospital in Plano, Texas, where I did my cardiology training. This is followed by my training in advanced cardiovascular imaging at the Minneapolis Heart Institute at Abbott Northwestern Hospital. I'm really excited to be here in Ashland to join family, colleagues, and the community here. Cardiac imaging is the cornerstone of cardiology and the heart team approach in solving challenging clinical cases from diagnosis, prevention, guiding treatments, and follow-up. As a cardiac imager, my primary responsibility is to utilize various imaging technologies and techniques such as echocardiography, cardiac CT, cardiac MRI, and nuclear cardiology to integrate all of this information to help our patients and formulate a plan that is tailored for each our patient. Cardiac MRI, there are a lot of new techniques and technologies and advancement. Now we utilize it for helping our patient to diagnose a lot of cardiomyopathy, guiding our colleagues from the electrophysiology department, guiding our interventional cardiologist in terms of their procedures, utilizing also for the structural heart disease, such as the valve, in approaching the right diagnosis and giving them the right treatment in the right time. Cardiac MRI went through a lot of revolution over the last 10 years. Now we can see the heart with high resolution, helping all of our colleagues and other departments in approaching our patients to the correct diagnosis, from heart failure, cardiomyopathy, reaching the right diagnosis, cutting the time to be able to reach to that diagnosis. Also at the same time, helping our colleagues from the interventional part to know exactly what type of disease they do have before they go to the procedure, in terms of helping the artery to open it up or just let it alone. Also helping our colleagues from the electrophysiology for patients who are having arrhythmias to know exactly where this is coming from, to know the scar tissue there, to be able to tackle that area, as this will cut their time, will help our patient and know exactly the disease process, and that's where we come from. Calcium score is a very powerful tool for preventing cardiac diseases. It's a very powerful tool to know your exact risk for future events. It's a non-invasive approach to know if you need the medications or not and how much lifestyle modification do we need. It's a wake-up call for many of our patients, especially patients who do not have symptoms. So we can catch it early on, we can act on this to prevent any life-threatening events in the future. Our mission is to care, to serve, and to heal. We achieve this by delivering a world-class care for our communities here. I look forward taking care of you and your loved ones.